Imagine this. You're with your pet. Maybe they seemed okay just yesterday, but suddenly they are really sick. Just
Yeah.
lethargic, not eating, maybe breathing funny, or just alarmingly weak.
Yeah.
That kind of terrifyingly rapid decline, well, it could be sepsis. It's a critical, life-threatening condition, and honestly, many pet owners might not grasp its full weight until they're facing it. It's just confusing and scary.
It really is, and understanding what's happening is so vital in those moments.
Exactly, and that's precisely what we're going to dive into today. You've shared some incredibly comprehensive veterinary clinical guides with us on sepsis and bacteremia in animals, like real expert-level stuff.
Very detailed material.
So our mission here is to unpack these sources together. We want to figure out what these terms really mean, understand the frightening process unfolding inside the body, why it's so incredibly dangerous, and what vets actually do to fight it. It's definitely complex medical territory.
It is.
But we're going to break it down, pull out the essential knowledge so you can be really well informed if, heaven forbid, you ever encounter this.
Okay. Where should we start?
Let's start right at the beginning with
Yeah.
the basics. What are we actually talking about? Let's define these terms based on the sources like bacteremia and sepsis.
Okay. So bacteremia, in its simplest form, just means there are viable, living bacteria present in the bloodstream.
So bacteria in the blood.
Right. And the sources point out this can actually happen transiently, like for a short period, maybe after a dental cleaning, or even a minor tummy upset. Usually the immune system just clears them out pretty quickly, but it's when that clearance doesn't happen effectively and you get a more persistent or, a significant amount of bacteria hanging around in the blood, that's when the serious problems can start.
Got it. So bacteremia is bacteria in the blood, but these guides are clear. That doesn't automatically equal sepsis. There's another critical piece they describe first, isn't there?
SIRS.
Exactly.
Yeah.
SIRS. That stands for Systemic Inflammatory Response Syndrome. Think of it as the body sounding a massive, widespread inflammatory alarm.
It's a generalized inflammation that, importantly, can be triggered by lots of things besides infection. We're talking major trauma, severe burns, pancreatitis inflammation of the pancreas, big surgeries, even things like heat stroke.
So it's not always infection-related.
Not always, no. And the sources list specific clinical signs vets look for that suggest SIRS is happening. Significant changes in body temperature, either too high or too low, a really fast heart rate, fast breathing, and specific changes in their white blood cell counts.
Okay, so SIRS is like this full-body red alert due to some major insult.
Yeah.
Now, here's where it gets, as you said, really interesting and specific. Sepsis. How do the sources define that compared to SIRS?
Right. So sepsis, according to these guides, is defined as life-threatening organ dysfunction caused by a dysregulated host response to infection.
Dysregulated response. That's the key phrase.
That's the absolute key. It's SIRS plus a confirmed infection, or at least a very strong suspicion of one. And crucially, the body's own attempt to fight that infection spirals out of control and starts damaging its own tissues and organs.
Wow. And the sources say this can actually progress, get worse.
Oh, absolutely. It's often a cascade. It can move from sepsis to what they call severe sepsis. That means you have sepsis plus clear evidence that one or more vital organs are starting to fail.
Like what kind of organ failure?
Well, maybe the kidneys aren't making urine properly, or the lungs are struggling to get oxygen into the blood. That's ARDS, acute respiratory distress syndrome, or the liver's failing, or the blood's not clotting right, things like that.
And then the most critical stage they mention, septic shock.
Yes. Septic shock is sort of a subset of sepsis. It's characterized by really profound problems with circulation, cells, and metabolism. Essentially, the patient has dangerously low blood pressure that doesn't respond properly, even when they get lots of IV fluids.
So fluids aren't enough.
Right. They often need potent medications, vasopressors, just to keep their blood pressure up. And another hallmark is typically very high levels of lactate in the blood.
Lactate, what does that indicate?
High lactate signals severe distress at the tissue level, basically that cells aren't getting enough oxygen. And what's really striking, and frankly quite grim, is how consistently these sources emphasize the extremely high mortality rate tied to septic shock. It really underscores how severe it is.
And if things continue down that path, the end stage is multi-organ dysfunction syndrome, MODS.
Correct. MODS. That's the failure of two or more major organ systems, kind of the final common pathway if the process isn't stopped.
So putting it all together, sepsis isn't just a bad infection, it's the body's own defenses running amok, causing widespread damage.
Exactly. It's a runaway train of inflammation, and that's why it's such a major killer in veterinary critical care units. These sources hammer home that early recognition and really aggressive treatment are paramount. It's the only real shot they have.
That makes total sense. So let's back up. Where does this terrifying cascade usually start? What are the common origins, the sources of infection that can kick this whole thing off?
Well, the sources are clear. Pretty much any localized infection anywhere in the body has the potential to escalate into bacteremia and then sepsis, especially if the animal is already vulnerable for some reason.
And the main culprits are bacteria?
Overwhelmingly, yes. Bacteria. Gram-negative types like E. coli, Klebsiella, Pseudomonas are really common, often because of endotoxins they release. But gram-positive bacteria like staph and strep are also major players, working through different toxins or cell wall components.
What about other things? Fungi, viruses?
Fungal infections like Cryptococcus or Aspergillus can cause sepsis, but it's less common, though often very severe when it happens. Viruses and protozoa, things like parvovirus or FeLV5, in cats, they rarely cause sepsis directly.
Oh, okay.
Their danger is more indirect. They severely weaken the animal's immune system, leaving them wide open to a secondary bacterial infection, and that bacterial infection is what then spirals into sepsis.
Got it. So thinking about those primary bacterial infections, where do they typically start in pets? The sources list quite a few common locations, which must help vets narrow things down.
Absolutely. Knowing the common sites is crucial for diagnosis. The GI tract, the gut, is a really frequent starting point. Think about peritonitis, that's inflammation spreading through the abdomen.
What causes that?
Often it's from a rupture, maybe a swallowed foreign object pokes a hole, or a tumor breaks open, or even following GDV, that stomach twist condition in dogs. Severe gut infections, like parvo, can also be a source.
Okay. GI tract, what else?
The urinary tract is another big one. Kidney infections, pyelonephritis, prostate infections or abscesses in male dogs. A really nasty one is pyometra, a severe infection in the uterus of unspayed female dogs and cats. Or even a ruptured bladder letting infected urine leak out.
What about breathing problems?
Definitely. Pneumonia, a lung infection, or pyothorax, which is pus collecting in the chest cavity around the lungs, both can lead to sepsis.
And skin issues.
Yes, severe skin and soft tissue infections. Think about deep, nasty bite wounds that get infected, large abscesses hidden under the skin, or even necrotizing fasciitis, that scary, rapidly spreading, flesh-eating type of infection.
Wow. Anywhere else?
Sure. Infections within the cardiovascular system itself, like bacterial endocarditis infection on the heart valves, or thrombophlebitis, which is inflammation and clotting in a vein, sometimes tragically starting from an infected IV catheter site.
That's worrying.
It is. Other sources mentioned include discospondylitis, an infection of the spine bones and discs, serious joint infections, a ruptured gallbladder spilling infected bile, or even pancreatitis if it gets complicated by a secondary infection.
It really sounds like an infection almost anywhere could potentially trigger this system-wide crisis.
It truly can. Which leads to a really important question the sources address. Who is most at risk? Which animals are most likely to have a seemingly localized infection just spin out of control into sepsis?
A weakened immune system seems like the obvious top factor.
Definitely number one. Of very young animals, puppies and kittens, and very old pets, their immune systems aren't as robust. And then anything that actively suppresses the immune system.
Like certain diseases or medications.
Exactly. Diseases like Cushing's, diabetes, feline leukemia, or FIV in cats, parvovirus. And critically, treatments like chemotherapy or long-term high-dose steroid use.
Okay. And what about damage to the body's natural defenses, like skin or gut barriers?
Yes, that's key too. Compromised barrier function. Severe burns destroy the skin barrier. Major trauma can cause widespread tissue damage. And significant damage to the lining of the intestines, like from severe inflammatory bowel disease or infections, can let bacteria leak through.
The sources also mention foreign material.
Right. Things like infected surgical implants, drains left in too long, or indwelling catheters, the Deflees catheters, urinary catheters. These can act as a nidus, like a hiding place for bacteria, constantly seeding infection into the body.
And sometimes it's just not catching the initial problem fast enough.
Sadly, yes. A simple delay in diagnosing and treating that primary infection gives it time to spread and potentially overwhelm the body's defenses. Multi-drug-resistant organisms also pose a huge challenge.
The guides had some even more specific notes on risk factors, didn't they?
They did. They mentioned things like large breed male dogs might be more prone to certain sources like endocarditis or discospondylitis. Pyometra and GI issues were noted for potentially causing very rapid peracute sepsis.
What about procedures?
Interestingly, yes. While generally safe, even things like rectal exams or the presence of indwelling urinary or IV catheters are listed as potential, though less frequent, routes for bacteria to gain entry. They also specifically called out glucocorticoids, steroids, as a significant risk factor because they can directly help bacteria multiply in tissues alongside suppressing the immune response. Other underlying issues like having the spleen removed, cancer, or chronic liver or kidney failure also increase risk.
Okay, this is incredibly complex. Let's try to unpack what's actually happening inside the body during the sepsis cascade. Walk us through that sequence, from the initial infection getting into the blood to organ failure.
Okay, so it starts when the microorganisms, usually bacteria or the toxic substances they release, like endotoxins or exotoxins, manage to get into the bloodstream from that initial site of infection. That's the bacteremia we discussed.
Got it. Bacteria in the blood.
Then the body's innate immune system, its first line of defense, recognizes these invaders or their products as danger signals. They use special receptors to detect patterns on the microbes, PAMPs, or signals from damaged host cells, DAMPs. This recognition activates immune cells.
And that's where the SIRS response kicks in.
Precisely. This activation triggers a massive body-wide release of inflammatory mediators, chemicals like cytokines, TNF-alpha, interleukin-1, interleukin-6, nitric oxide. It also activates other systems like the complement cascade, the coagulation system, clotting, and the fibrinolytic system, clot breakdown.
So the SIRS criteria vets looks at the fever, fast heart rate. Those are signs of this inflammatory storm starting.
Exactly. Those signs are part of the body's normal protective response to fight infection. But the definitional sepsis hinges on this response becoming dysregulated. It goes from a controlled burn to an out-of-control wildfire.
And that wildfire starts causing collateral damage.
Yes, major damage, especially to the blood vessels. This leads to several critical problems with circulation. First, widespread vasodilation. The blood vessels relax and open up too much,
Which causes blood pressure to drop.
dramatically, leading to what's called distributive shock. Even if the heart is pumping okay, the pipes are too wide, so blood pressure plummets and blood flow to vital organs becomes inadequate. Second, the vessel walls become leaky.
Leaky vessels.
Yeah, increased permeability. Fluid starts oozing out of the bloodstream into the surrounding tissues, causing swelling or edema, and further reducing the effective circulating blood volume.
And you mentioned clotting problems too.
Critically important, yes. The inflammatory chaos inappropriately triggers the coagulation system. This leads to the formation of tiny little blood clots, microthrombi, throughout the smallest blood vessels, the capillaries.
So clots blocking the tiny vessels.
Exactly. Widespread microvascular thrombosis. This physically obstructs blood flow at the tissue level, preventing oxygen delivery even if the larger circulation seems okay after giving fluids. This is a major cause of tissue hypoxia, oxygen starvation in the cells.
And if cells can't get oxygen, they can't make energy properly, leading to that lactate buildup.
Spot on. That's the cellular metabolic dysfunction part. Mitochondria, the cell's powerhouses, struggle to use oxygen effectively even if some gets there. So cells desperately switch to anaerobic metabolism, making energy without oxygen, which is very inefficient and produces lactic acid as a byproduct. That elevated blood lactate we measure is a direct reflection of this cellular crisis.
It's fascinating and terrifying how interconnected this all is. Now, the sources mention something really paradoxical. While this massive pro-inflammatory response is raging, the immune system can also become suppressed.
Yes, it's one of the cruel ironies of sepsis. Almost simultaneously with the pro-inflammatory storm, SIRS, a compensatory anti-inflammatory response system, often called CARS, gets activated. In some patients, this anti-inflammatory response can overshoot.
Leading to what?
It can lead to a state of immunoparalysis, where the immune system becomes ineffective, leaving the animal extremely vulnerable to new secondary infections or unable to clear the original one. It's this dangerous imbalance, too much inflammation causing damage, and potentially too little effective defense happening at the same time.
And ultimately, all this accumulated damage, the low blood pressure, the leaky vessels, the microclots starving tissues of oxygen, the cellular dysfunction, this leads to organ failure.
That's the end result. Persistent hypoxia, direct cellular damage from inflammation and toxins, the microthrombosis. It all leads to organ dysfunction and eventually failure. Kidneys fail, acute kidney injury, AKI. Lungs fail, ARDS. Liver, heart, brain. And that clotting system breakdown we talked about can lead to DIC-disseminated intravascular coagulation, where they might paradoxically bleed uncontrollably because all the clotting factors got used up forming microclots.
And septic shock is that critical point where circulation and metabolism are just fundamentally failing.
Exactly. Persistent low blood pressure despite fluids, high lactate. It's a state of profound crisis.
Wow. Okay, that's the internal chaos.
Yeah.
How does this actually look on the outside? What clinical signs might an owner or a vet actually see in a pet?
Yeah, the clinical signs are notoriously tricky because they can be so variable and things can change incredibly fast. What you see really depends on the stage, the severity, which organs are hit hardest, and the sources emphasize some really important differences between dogs and cats.
Right, you mentioned dogs often present differently early on.
Yes, dogs are often described as being more likely to show signs of an early hyperdynamic or warm shock phase, especially initially.
Hyperdynamic, what does that look like?
You might see a fever, though, remember. Temperature can drop later, becoming hypothermic, a very fast heart rate, rapid breathing, and the really classic signs are bright red or injected-looking gums.
Brick red, they sometimes call it.
Exactly, brick red gums. And a very fast capillary refill time, or CRT, that's when you press on the gum and the color bounces back almost instantly, like less than 1 second. Their pulses might feel very strong, sort of bounding.
But they'd still be sick.
Oh, yes. Despite those strong signs, they'll likely be lethargic, weak, definitely not eating, maybe vomiting or having diarrhea. It's a deceptive picture sometimes.
Okay, and cats, you said they're often different.
Cats, interestingly, often seem to bypass that hyperdynamic phase, or it's very transient. They frequently present in what's considered the later hypodynamic or cold shock phase right from the start, or dogs can progress to this stage too.
And hypodynamic looks much worse.
It looks much more like classic shock. Often hypothermia, a low body temperature, which in sepsis is usually a very grave sign. Cats are also quite prone to having a slow heart rate, bradycardia, when they're in shock, which is different from dogs where that's usually a sign of impending collapse.
So slow heart rate in a shocked cat isn't as ominous.
It's still very serious, but it's a more common finding in cats in shock compared to dogs. Their gums will likely be pale or even muddy grayish. Capillary refill time will be slow, definitely longer than 2 seconds. Pulses will feel weak, thready, or even absent. They'll have low blood pressure, be severely depressed, maybe even comatose. They might not be producing much urine. And you could potentially see signs of DIC, like tiny pinpoint bruises called petechiae, or larger bruises, ecchymoses.
It's really striking how different those initial presentations can be. A dog might look hot with red gums, a cat might be cold and pale, but both could be facing the same underlying life-threatening sepsis.
Absolutely. And that difference, especially the more subtle or shut down presentation in cats, can make early recognition challenging sometimes. It highlights why any sudden severe illness needs immediate attention.
Definitely. So given this variability, how do vets actually piece it all together? How do they diagnose sepsis? It sounds like it requires a lot of suspicion.
A very high index of suspicion is crucial, especially if you have an animal that fits the risk profile or one that's just crashing rapidly. It's really about connecting the dots. The clinical picture you're seeing, checking if they meet those SIRS criteria we talked about, and then actively hunting for that source of infection.
And the sources gave specific numbers for those SIRS criteria.
They did. Vets check temperature, heart rate, respiratory rate, and white blood cell counts against established criteria. Interestingly, the guides note slightly different thresholds and numbers needed to meet the definition of SIRS in dogs versus cats.
Reflecting their different responses.
Exactly. For example, dogs might need 2 or more criteria met, while cats might need 3 or more, based on the specific values listed in these veterinary sources.
But you stressed earlier SIRS alone doesn't mean sepsis.
Critically important reminder, yes. SIRS just confirms significant systemic inflammation. It must be interpreted alongside evidence or strong suspicion of an underlying infection. Lots of non-infectious things cause SIRS, so it's not specific on its own.
Okay, what other lab tests are key in working up a suspected sepsis case?
Blood lactate is a really big one. As we discussed, elevated lactate, the sources often use a threshold around 2.5 millimolar or higher, is a strong indicator of tissue hypoperfusion, that oxygen delivery problem. It helps assess severity and can be tracked to monitor response to treatment. It's a major prognostic indicator, too.
What about blood sugar?
Glucose can be high initially due to stress hormones, but later in sepsis, especially in dogs, it can drop dangerously low, hypoglycemia, and that's generally considered a very poor sign. The sources mention some conflicting data regarding hypoglycemia in cats, but low is generally bad. Low blood protein, specifically albumin, is also very common.
And checking clotting.
Essential. Doing coagulation tests like PT and APTT, checking platelet counts, and maybe levels of FDPs or D-dimers, clot breakdown products. If these are abnormal, it points towards DIC, that dangerous clotting cascade failure. And of course, standard blood work to check kidney values, BUN, creatinine, and liver values, enzymes, bilirubin, to assess for organ damage is routine.
And then there's the hunt for the source infection itself.
Absolutely vital. Imaging is key here. X-rays, ultrasound, sometimes even CT or MRI are used to look for things like abscesses hidden deep inside, fluid in the chest or abdomen effusions, foreign bodies, evidence of organ rupture like a pyometer or gut perforation.
On analyzing fluids or samples?
Yes. If there's abnormal fluid buildup, sampling it, paracentesis for abdominal fluid, thoracocentesis for chest fluid, for analysis and culture is crucial. Cytology, looking at cells under a microscope from wounds or abscesses, can give quick clues, and a urinalysis with culture is standard to check for urinary tract infection.
The ultimate confirmation of bacteria in the blood, though, is the blood culture. The sources had quite detailed guidelines for that, right?
Yes, blood culture is considered the gold standard for definitively proving bacteremia, identifying the specific bug, and importantly, figuring out which antibiotics will kill it. Sensitivity testing. The guidelines emphasize a few key things for getting meaningful results.
Like when to collect them.
Ideally, collect the samples before starting any antibiotics, if possible. However, and this is crucial, you should never delay starting emergency antibiotic treatment just to wait for cultures if the animal is critical. Get the samples quickly if you can, then start treatment immediately.
And how many samples?
They strongly recommend collecting multiple sets, usually 2 or 3 samples from different veins, often at different times. This massively increases the chance of catching the bacteria if they're present intermittently, and it also helps distinguish a true positive result from simple skin contamination during collection.
Volume matters, too.
Yes. The sources state that collecting an adequate volume of blood per culture bottle is important for maximizing the yield. They give recommendations, even for smaller patients using pediatric bottles. For timing, in a stable patient being worked up, maybe 3 cultures over 24 hours. But in a critically ill, suspected septic patient, the recommendation is often to get those 3 samples much faster, perhaps over just a couple of hours because time is of the essence.
And the collection itself needs to be super sterile.
Absolutely meticulous. Strict aseptic skin preparation is vital to avoid growing skin bacteria that aren't actually in the bloodstream. You need to thoroughly scrub the site, collect the blood with a sterile syringe and needle, and then, this is important, use a brand new sterile needle to inject the blood into the special culture bottles. Don't use the same needle you poke the skin with.
How do vets interpret the results once they're back? It takes time, right?
It does take time, usually a few days for bacteria to grow. Interpretation depends on what grows and from how many samples. The sources suggest that a single positive culture, especially if it's a common skin contaminant like a coagulus negative staph, might just be contamination.
For multiple positives are significant.
Generally, yes. If 2 or more cultures grow the same organism, that's highly suggestive of true bacteremia. Or, if certain types of bacteria known to be highly pathogenic, like E. coli, Pseudomonas, Staph aureus, certain strep species, or yeasts, grow from even one culture, that's almost always considered significant. Conversely, if multiple properly collected cultures come back negative, it makes significant bacteremia with common pathogens much less likely.
Okay, so diagnosis is this multi-pronged approach. Suspicion, clinical signs, SIRS criteria, lab work including lactate, imaging to find the source, and ideally, blood cultures. Once sepsis is diagnosed, or at least strongly suspected, what's the treatment plan? It sounds intense.
It is. Treatment is immediate, it's aggressive, and it involves attacking the problem from multiple angles simultaneously. It almost invariably requires hospitalization, usually in an intensive care unit, ICU. The sources are crystal clear. Success hinges on acting fast and providing continuous, careful monitoring and support. They even talk about a golden hour for that initial push.
The golden hour. What happens then?
The first priority is rapid resuscitation to stabilize the circulation. Fluid therapy is the cornerstone. Aggressive intravenous fluid boluses are given to try and restore blood pressure and tissue perfusion.
They gave specific amounts.
Yes. The sources often quote typical shock bolus volumes for dogs and cats, emphasizing that cats are generally less tolerant of huge volumes and often do better with smaller, repeated boluses to avoid fluid overload, which they're prone to.
What kind of fluids?
Usually isotonic crystalloids like LRS or plasmolite are the first line, but if albumin is very low or if there's concern about leaky vessels, they might add colloids like hetastarch or plasma or albumin transfusions. And if the patient is anemic or has clotting problems like DIC, blood products packed red blood cells or fresh frozen plasma might be needed.
And oxygen.
Absolutely essential. Oxygen supplementation is given to maximize oxygen delivery to those struggling tissues. If IV fluids alone aren't enough to bring up dangerously low blood pressure, that's when vasopressors come in.
Medications to squeeze the blood vessels.
Exactly. Norepinephrine is listed as a common first choice in the sources, but others like vasopressin or dopamine might be used. If there's evidence the heart muscle itself isn't pumping strongly, poor contractility, drugs called inotropes like dobutamine might be added. And if blood sugar is low, IV dextrose is given.
Okay, resuscitation first, then antibiotics.
Immediately alongside resuscitation. As soon as those blood cultures are collected, or even before, if collection isn't feasible without delay, broad-spectrum 5E antibiotics are started empirically.
Empirically meaning based on a best guess.
Right. Based on the likely source of infection and common bacteria in that location, you choose antibiotics that cover a wide range, typically gram-positives, gram-negatives, and sometimes anaerobes. The sources provide examples of common combination protocols, maybe a fluoroquinolone plus something like ampicillin sulbactam or metronidazole, or even powerful carbapenems for very severe cases.
And specific drug examples.
Yes, they mention specific drugs and doses, sometimes used as examples, like cefazolin or gentamicin, emphasizing the need for appropriate dosing in these critical patients. The crucial part is starting something effective immediately. Then, once those culture and sensitivity results come back in a few days, the antibiotic choice can be narrowed or adjusted to specifically target the confirmed bacteria.
That makes sense. Now, the sources really hammered home the importance of source control.
Often, this is arguably the most critical step for survival. You absolutely have to eliminate or control the original source of the infection, if possible.
So, surgery.
Frequently, yes, once the patient is stable enough for anesthesia. If there's an abscess, it needs to be surgically drained. If there's a foreign body causing infection, it needs removing. If there's dead necrotic tissue, it has to be debrided. If an organ has ruptured, like the intestine or an infected uterus, pyometra, it needs surgical repair or removal. Any potentially infected catheters need to be pulled. Without source control, the antibiotics and fluids might just be fighting a losing battle.
Okay, so resuscitation, antibiotics, source control. What else is involved? There's a lot of supportive care mentioned.
A tremendous amount. It's really about supporting every single body system that's under strain. Managing GI issues with anti-nausea meds, stomach protectants, providing nutritional support is vital. The gut barrier breaks down quickly without nutrients, so early feeding, often through a feeding tube, is preferred.
Yeah.
Pain management is crucial, usually with opioids.
What else?
Maintaining body temperature, warming them if they're cold, sometimes cooling if they have a persistent fever. Actively managing DIC if it develops, sometimes using heparin or blood products. Providing respiratory support if needed, maybe even mechanical ventilation, a ventilator, for severe ARDS. Supporting kidney function, potentially with dialysis if they go into acute failure. And constantly monitoring and correcting electrolyte imbalances and acid-base problems. It's true multi-system support.
What about steroids? You mentioned them as a risk factor. Are they ever used in treatment?
Great question, and the sources are very clear here. Corticosteroids are generally not recommended for routine sepsis treatment. The concern is that they further suppress the already dysregulated immune system, potentially making things worse, or increasing the risk of secondary infections.
Are there any exceptions?
The main exceptions noted are if the animal has confirmed Addison's disease, hypodrenocorticism, where they don't produce their own steroids, or if there's strong evidence of something called relative adrenal insufficiency, where their adrenals just can't keep up with the massive stress of sepsis. But for the average sepsis case, no steroids.
This level of care sounds incredibly intensive and likely very expensive. What's the actual outlook? What's the prognosis for a pet diagnosed with sepsis?
Yeah, unfortunately, the prognosis overall remains guarded to poor, even with the best care. That said, outcomes are improving as veterinary critical care advances, but many factors heavily influence the chances of recovery.
Like how quickly treatment starts.
Absolutely. Promptness of diagnosis and starting aggressive treatment is huge. The nature of the infection source also matters. Is it something easily fixed surgically, like a pyometra, or something diffuse and hard to control? The severity of the sepsis itself is critical.
How do they measure severity?
Animals presenting an established septic shock, those with evidence of multiple organ failure, MODS, or those with persistently high lactate levels, these factors consistently point to a much poorer prognosis in the studies cited.
And the pet's general health beforehand matters too.
Definitely. Their underlying health status, age, any pre-existing conditions, their immune competence all play a role. How well they respond to that initial fluid resuscitation can also be an early indicator. And sadly, the sources do acknowledge that financial limitations and the availability of 247 intensive care can impact treatment options and outcomes.
The sources even cited some pretty stark mortality figures to drive home the severity.
They did. The numbers vary between studies and depend on the specific condition, but they mention ranges like 21% to potentially up to 68% mortality for dogs with septic peritonitis, around 70% mortality for dogs documented with organ failure, maybe around 40% for cats with sepsis overall, and they noted that untreated septic shock approaches 100% fatality in some reports. It really is a devastating condition.
Given how dangerous it is, and the difficult prognosis,
Yeah.
can we do anything to prevent sepsis in the first place?
Prevention really boils down to two main things: managing those underlying risk factors we talked about, and crucially, controlling primary localized infections before they get a chance to escalate.
So treating infections promptly.
Exactly. Prompt veterinary attention and appropriate treatment for any localized infection, whether it's a skin wound that looks infected, a suspected urinary tract infection, significant dental disease. Don't let these things linger. Vaccination is also key, especially against diseases like parvovirus that directly attack the immune system and pave the way for secondary sepsis.
What about in the hospital setting?
Strict hygiene and aseptic technique are paramount. During surgeries, handling wounds, and especially when placing and maintaining IV or urinary catheters, meticulous care prevents introducing infection. Good general nutrition helps support a robust immune system. Effectively managing chronic diseases like diabetes or Cushing's helps reduce susceptibility, and using immunosuppressive drugs like steroids only when truly necessary and at the lowest effective dose.
And owner awareness seems like it would be a huge part of that prevention chain too.
Absolutely critical. Educating owners to recognize potential early warning signs like persistent fever, sudden profound lethargy, complete loss of appetite, difficulty breathing, unexplained collapse, and understand that these warrant immediate veterinary assessment. Catching problems early, when they're still localized, is the best defense against them spiraling into sepsis.
Looking back at everything we've discussed, these sources really did highlight some fascinating and clinically very important differences between dogs and cats in how they experience sepsis.
They really did. That initial presentation difference is probably the most striking. Dogs often showing that warm shock, initially the red gums, bounding pulses, whereas cats tend to present in that cold shock state, hypothermic, pale, weak pulses, maybe bradycardic.
Which makes spotting it early potentially harder in cats.
It can, yes. Their signs might seem less dramatic initially, even though the underlying process is just as severe.
And even the SIRS criteria numbers are different between them.
Right, reflecting those inherent physiological differences in how their bodies mount an inflammatory response.
Other key differences mentioned were variations in common infection sources, the significance of bradycardia and shock being more common in cats, and importantly, their tolerance for IV fluids.
Yes, that fluid tolerance point is huge clinically. Cats are much more susceptible to fluid overload and developing pulmonary edema if given fluids too aggressively compared to most dogs. That's why a more cautious approach with smaller, repeated boluses is often advocated for cats. Understanding these species-specific nuances is vital for providing safe and effective treatment.
Okay, so to kind of wrap this deep dive up, sepsis fundamentally isn't just a severe infection. It's really this terrifyingly chaotic, self-destructive overreaction by the body to that infection.
That's the essence of it. The body's own defense mechanisms go rogue and start attacking its own vital organs. And recognizing the signs, which can be subtle or change rapidly, and getting immediate, intensive veterinary care is absolutely the most critical factor determining whether they have any chance of survival.
So what does all this really mean for you listening to this, maybe as a concerned pet owner? I think it underscores just how incredibly quickly a serious infection can escalate into a true life or death crisis, and how absolutely vital that early intervention window is.
It really does. It highlights the urgency. If your pet is suddenly severely ill, profound weakness, won't eat, trouble breathing, collapse, don't adopt a wait-and-see approach. Seek veterinary help immediately. Time is truly of the essence.
You know, thinking about this whole incredibly complex cascade, it really makes you appreciate the sheer power of the body's immune system. But it also shows how dangerous it can be when that power becomes dysregulated, when it loses control. Kind of leaves you with a provocative thought, doesn't it? About balance. In sepsis, it seems like both too little immune defense against the bug and way too much uncontrolled inflammatory response. Both paths can be equally fatal. Finding that balance is the ultimate challenge.